Section 2, Part D, pre-exercise and pre-testing instructions. This is from the ACSM guidelines, chapters 2 and 3. I'm basically skipping the pulmonary testing. There's certain things that you could do with pulmonary testing. You could test the spirometry. One of the big things with spirometry is you want to see how much a person can exhale, what percentage of their lung volume they can exhale in 1 second. Which is useful for various types of testing. However, for the general population, that's typically going to be normal. So some participant instructions. Explicit instructions for our participants before exercise testing increases test validity and data accuracy. So we want to make things as consistent as possible, as normal as possible. Participants should refrain from ingesting food, alcohol, or caffeine, or using tobacco products within 3 hours of testing. Generally, we want to make sure that the people adhere to their normal routine. So caffeine and tobacco use, it'll be up in the air. So some people will adhere to this, some people won't. It's not much you can do about it. The alcohol or other recreational drug use, that is what should be mitigated as much as possible, as well as addressing general pharmaceutical drugs that may affect the exercise test. So if somebody's on ADHD medication or albuterol, that can also affect the test results. So contact a physician regarding those types of medications and an exercise test. Generally, we try to not have the person use the substance for at least 3 hours before. One thing to watch out for is we don't necessarily want the individual to be having withdrawal symptoms during the exercise test. So I think that's something to kind of keep in mind. Participants should be rested for the assessment, avoiding significant exertion or exercise on the day of the assessment. So this is a major issue within the exercise science classes and the exercise prescription laboratory experiences. People will conduct an aerobic exercise test, and then they will have done a leg workout the day before. Don't even get me started on this. That leg workout is definitely going to have an effect on the aerobic exercise test because the legs are going to be fatigued or you'll have delayed onset muscle soreness. So as much as possible, take time off a day or two to make sure that the person is fully recovered from any previous bout of activity and they're ready to go. I'd also take into consideration, do they have any residual delayed onset muscle soreness? If they do, then ideally they should wait to complete the assessment until they do not have a delayed onset muscle soreness anymore. So kind of keep that in mind. They should treat the exercise test as if it were like an event and get ready for it accordingly. So clothes should permit freedom of movement and include walking and running shoes. Women should bring loose-fitting short-sleeve blouse that buttons down the front and should avoid restrictive garments. This is more associated with cardiac rehab, and if a person is going to get an ECG, you have to work around the bra and having easier access to a bra in the chest area so they can place electrodes on the individual is what this stems from. If a person is generally doing an exercise test, a aerobic exercise test without an ECG, or things like one repetition maximal testing, movement testing, functional movement testing, then as long as they're wearing the same clothes that would be recommended for a man, a t-shirt, anything that's loose fitting, that's easy to, that's not restrictive, will be fine. Participant instructions: if the evaluation is on an outpatient basis, participants should be made aware the exercise test may be fatiguing. They may wish to have somebody accompany them to the assessment to drive home afterwards. Again, for college students, this is much less of an issue. For an older individual or an individual where you suspect cardiovascular issues or disease, that may be more of an issue. So if the exercise test is for diagnostic purposes, it may be helpful for patients to discontinue prescribed cardiovascular medications, but only with the physician's approval. So the physician wants to see how well is your heart working without the medications. So how good is its function? Currently prescribed anti-anginal agents alter the hemodynamic response to exercise and significantly reduce the sensitivity of the ECG changes for ischemia. So, and that's going to patients taking high dose beta blockers may be asked to taper their medications over a 2 to 4 day period to minimize a hyperandrogenic withdrawal response. So we don't want people to just stop taking their medication. We want to make sure that they stop taking it in a appropriate fashion, and a pharmacist and a physician will aid in that. But we've got the issues of prognostic testing, which is also functional testing, which will be the next slide, as versus diagnostic testing, where you're just trying to see what is the function of the heart. Is there any issues associated with the cardiovascular system that we need to know about, that the physician needs to know about from a health perspective. Participant instruction: if the test is functional for exercise prescription purposes, the patient should continue their medication regimen on their usual schedule so that the exercise response will be consistent with their response during exercise training for their normal life. So if they're normally taking beta blockers, and we're trying to develop an exercise prescription, we want them to take the beta blocker while they're doing the exercise test as well. So it's a matter of looking at the heart function versus looking at, okay, when we're developing an exercise prescription for the individual, what are we going to be doing? So there's a slight nuance differences there. Participants should bring a list of their medications, including dosages and frequency of administration, to the assessment, and should report the last actual dose taken. As an alternative, participants may wish to bring their medications with them for the exercise staff to record. So you'll see patients do this, especially when they're taking a lot of medications. They'll bring a bag with all the medications in it. That's a good idea. It makes it easier, and then you can see what are they actually taking. Participants should drink an ample amount of fluids over a 24-hour period preceding the test to ensure hydration. Make sure that the individual is normally hydrated. And this is a lot of these instructions. Some of them are geared more towards clinical populations, but they're going to be true for the college-age student as well. So we want to get the best result we can. Want to get the most accurate result that we can. So we want to take some basic precautions, and we want the individual to be set up to be as successful as possible. So anything that could be done to avoid that is recommended. So, and you could take this on a case-by-case basis. If you have a college-age student, you may address alcohol consumption the day before the test, or studying the day before the test. If the person says they pulled an all-nighter right before doing an exercise test, that's not recommended. You won't see that in any of the texts, but it is kind of understood and that people won't do that. For clinical populations, it's unlikely that would be an issue, but for college students, it could definitely be an issue. So any issues like that you may see come up that may affect the participant's ability to complete an exercise test should be addressed to make sure that all the exercise testing is safe and you could get the best, most accurate results possible. Okay, that's it.